You see, I've helped people just like you overcome back and hip pain by precisely aligning their head over their neck. Now, I know that concept seems a bit foreign. In fact, I thought the same thing. How can a gentle upper neck realignment help someone with a back and hip problem? Well, I'm here to tell you that it can and that there is hope. You see, back and hip pain is one of the two most common problems we help people with. And in fact, most back problems are neck problems in disguise. Let that sink in. Now, how do I know this? Because they've tried everything, but no health professional has actually done a deep dive into the structural alignment of their upper neck. They overlook it, the most important part of the body. And that's where I specialize, and why my practice members get such great results. You see, in my experience, the most overlooked cause of back and hip pain is head and neck trauma. Now, whether that's from sports growing up, concussion, car accident, or whiplash injury, because here's what usually happens. When the head and neck are injured, the upper neck bones will misalign from one another, which completely distorts posture. Now, the rest of the spine will sacrifice itself, start to bend and twist just to protect the neck. Now, why would the body do that? Because the upper neck is closest to the brain. So now, because of this postural distortion, you'll typically shift your weight leaning to one side more than the other. Now, over time, this can lead to low back and hip pain. Now, this part is your body telling you that there's a problem and that it could be stemming from your neck. Now, regardless of what symptoms you have, we need to find out if your back and hip pain is being caused by a structural misalignment of the head and neck. Now, how do we do this? Well, I'll walk you step by step through our assessment. Now, if you pass our assessment, this is great news, and we can rule out upper neck misalignment as a cause of your back and hip pain. And I'll also be able to point you in the right direction of another health professional. But if you don't pass my assessment, then this tells me that I can help you, which is also great news. So what do you say? Let's get that assessment or phone call scheduled so we can get this corrected for the long term so you can live your best life.